Pramipexole is a non-ergot dopamine agonist used to treat the signs and symptoms of idiopathic Parkinson's disease and Restless Legs Syndrome (RLS). In this video, let's found. What is Pramipexole? What is Pramipexole used for? Contraindication. What are the side effects of taking Pramipexole? How does Pramipexole work? How to use Pramipexole? What is Pramipexole? Pramipexole, sold under the brand Mirapex among others, is medication used to treat Parkinson's disease and Restless Legs Syndrome. In Parkinson's disease it may be used alone or together with levodopa. It is taken by mouth. Pramipexole is a dopamine agonist of the non-ergot class. Pramipexole was approved for medical use in the United States in 1997. Use in pregnancy and breastfeeding is of unclear safety. It is available as a generic medication. In 2020, it was the 193rd most commonly prescribed medication in the United States, with more than 2 million prescriptions. What is Pramipexole used for? This drug is indicated for the symptomatic treatment of Parkinson's disease. This drug can be administered as monotherapy or in conjunction with levodopa. It is also indicated for symptomatic treatment of moderate to severe primary restless legs syndrome (RLS). Contraindication. Hypersensitivity to pramipexole or any component of the formulation. Side effects. Common side effects of pramipexole may include headache, peripheral edema, hyperalgesia, body aches and pains, nausea and vomiting, sedation and somnolence, decreased appetite and subsequent weight loss, orthostatic hypotension, resulting in dizziness, lightheadedness, and possibly fainting, especially when standing up, insomnia, hallucinations, seeing, hearing, smelling, tasting or feeling things that are not there, amnesia and confusion, twitching, twisting, or other unusual body movements, unusual tiredness or weakness. Pharmacodynamic. Parkinson's disease. Through the stimulation of dopamine receptors, pramipexole is thought to relieve the symptoms of Parkinson's disease. The motor symptoms of Parkinson's disease occur partly due to a reduction of dopamine in the substantia nigra of the brain. Dopamine is a neurotransmitter that has major effects on motor movements in humans. Restless Legs Syndrome. Pramipexole likely restores balance to the dopaminergic system, controlling the symptoms of this condition. Restless Legs Syndrome is thought to occur, in part, through dysfunction of the dopaminergic system, resulting in unpleasant lower extremity symptoms. Mechanism of action. The exact mechanism of action of pramipexole as a treatment for Parkinson's disease is unknown at this time. It is thought, however, that the ability of pramipexole to cause stimulation of the dopamine receptors in the striatum of the brain, a region that receives a vast array of neurological and is responsible for a wide variety of functions, may be involved. Pramipexole is considered a non-ergot dopamine agonist that shows specificity and strong activity at the D2 subfamily of dopamine receptors in vitro, binding selectively and dopamine D2 receptors and showing a preference for the dopamine D3 receptor subtype rather than other subtype. Half-life. About 8.5 to 12 hours. Dose. Parkinson disease. Immediate release, 0.125 mg PO, Q8HR initially, gradually titrated upward at weekly intervals to target range of 1.5 to 4.5 mg/day PO divided Q8HR. Extended release, 0.375 mg per day PO initially, if necessary, may be increased every 5 to 7 days, first to 0.75 mg per day and then by increments of 0.75 mg per day, not to exceed 4.5 mg per day. Restless Legs Syndrome. 0.125 mg per day PO 2 to 3 hours before bedtime initially, may be increased every 4 to 7 days up to 0.5 mg per day, every 14 days if circle 20 to 60 ml/min. Safety advice. Pramipexole is U.S. Food and Drug Administration Pregnancy Category C. That's all the information about Pramipexole we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.